Hi, PLAB aspirant. This is Dr. Rashid from PLAB Guide Academy. Today, I'm going to talk about what the PLAB 2 is and how you should prepare, what are the important skills that you need, and what our full course offers you to progress and pass your exam. PLAB 2 skills are extremely important that you need to pass this examination. It's a set of skills, and you will be tested in different scenarios. You may be working in the emergency department. Sometimes you are working in the GP practice. Sometimes you are working as a psychiatry SHO, or maybe a trauma and orthopedic. So you will be given different scenarios where you will have to see different patients, and in every single scenario there are certain skills that you need to show and a certain level of professionalism that you need to show. Now let me talk to you about what are the main components that you need to show your examiner so that you can pass your exam. In your examination, these are the set of the skills that you will be showing to your examiner so that you can pass your exam without any difficulty. So first of all, you need to show that you are ready to practice. Then you need to show that you can manage the uncertainty when you are not sure what is going on with the patient and how to get the help and who to get the help from. And if you are able to deliver a plan which is patient centered, which is more specific to the same patient that you are seeing, not to the whole generation and the whole population. So any patient coming with a chest pain from different age groups will need different plans. So you cannot apply one single plan to all the patients. So similarly, with many other complaints. So you need to be able to show all those skills, which means that essentially you are going to deal with the different patients and you require different set of skills to pass this examination. And working on the syllabus and the criteria for passing this PLAB 2 and looking into different skills that are needed, we divided the PLAB 2 skills into two different components and the modules. A few of them are the basic modules and a few of them are more advanced. So it is important that you understand what are the basic and you are ready for the basic and you can deal with the basic skills before you are stepped up for the more complex and the advanced skills. Now, talking about those basic skills that you need for this exam, we have created course which is a PLAB 2 course, and we divided those skills into two different components, a foundation part and the smart part. In the foundation part, I'm going to talk about we start the candidate preparation, teaching them from the scratch with the very basic how to take the history, what are the main component, main factors which are required and which are looked into, and we provide them feedback so that they can progress from the basic skills to the higher level skills. And we spend 10 days for teaching the basic skills, and every day we make it more complex and we progress to the more complex and advanced skills. In our smart course, in our full course, you get access to two different courses, which are, if I can show you here. So when you enroll, you will get access to the full course and the smart course. In the full course, we teach for 10 days and start with preparation, with the introduction of the PLAB 2 examination, introduction of different skills and the overview of the overall scenario and how the examination is taken and conducted and how the examiners are looking on the candidates when they perform, what are the factors that can affect the candidate's performance and the overall outcome. So we work 10 days for that, and in that initial 10 days we continue interacting, we continue giving them different scenarios and providing them the feedback, as well as we provide them the teaching on different situations. So the course is conducted beautifully for 16 days, initial 10 days on the foundation modules, and next 6 days on the advanced module, where the more complex skills like saving a life in sim scenarios, writing the safe prescription, and performing clinical examination on the patients and on the mannequins, similarly performing certain procedures which are required, which will be your day-to-day activities and the part of your job, and then teaching the scenarios in different environment of teaching, where you may be required to teach some certain task and the certain skills, or the examinations to your peers, like the nurses or the medical students who will be coming onto the ward. So in our full course you will get access to foundation course as well as to the smart course. Now let me show you how this is split and how this is delivered by the PLAB Guide Academy. In this you can see this is a foundation course. After you enroll, you will find 2 courses in My Courses tab. That will be PLAB to full course and the smart course. In the full course, you actually get the foundation program, foundation modules for 10 days, where a teacher will be teaching you every day for continuous 10 days. In those 10 days, we start with the day 1 on Friday, and these are the main areas that we cover. Introduction of the PLAB 2, general approach to the exam, and general medicine and allied part 1. And then on the next day, we carry on and continue teaching general medicine and allied part 2. And then we cover surgery and allied, ENT, eye, and then day 5 we cover workplace scenarios and the concerned family members, how to deal with them, what are the different legal and ethical aspects of different situations. And we continue teaching and covering all those areas, including the gynae and obs, peds, genitourinary, dermatology, psychiatry, breaking bad news. All those components are covered within 10 days. And these are all interactive sessions. Once you have completed that, we will move you and step you up to the PLAB 2 Smart course component, which is a smart skills and the advanced skills. This is why we call it the smart course. And these are the advanced skills that you will need to pass your exam. Here, actually, the real game starts. We start this course on Monday in our campus in Manchester. And on Monday, we do all day sim, and all the scenarios are discussed. Every single candidate performs on our real sim. In most of the academies in the UK, they even do not allow the candidate to touch their sim man. Many of them even do not have the real sim man. So we do have 2 real sim mans where we ask the candidate to perform, give them feedback, so that our candidates are very well looked after and they are confident on the day of their exam. On Tuesday, we start practice on the mannequins and the clinical examination. It is not just a practice, we do teach as well as we provide them feedback. Every single candidate practices under the supervision, gets the feedback so that they can improve. And we carry on, we continue the mannequins and clinical examinations on Wednesdays. Then on Thursday, 2 different scenarios. We cover 2 different scenarios. All the prescriptions and the teaching scenarios are covered on Thursday, every single Thursday. And then Friday and Saturday, we cover the recurrent scenarios which have been encountered in the GMC exam. For the PLAB 2, we provide the maximum feedback, the supervision to the candidates so that they can be ready and they are aware of the exam stress and all those kind of things. And after this, the game is not over. Next is the PLAB to full mock that we do. We have a high level full mock, that's a 16 stations, and you get 2 full mocks with this. And in every single mock we have the simman, we have the mannequins, and we have the prescription and telephonic station, video consultation, everything, all the scenarios are really mixed as in your real exam. So our mocks are also very high standard. In our mock, we provide the recordings of the performance to all the candidates. They get the link and they get the result card as in the real exam. In the links for every single scenario, they get the link to the audio of the recordings of their performance, that they can listen to themselves what they have been doing. And our result card is really very good, and it analyzes, it gives the result after comparing the performance of the candidate with the other candidates who took the same mock in last 90 days. Because we believe that we need to give you a real reflection of your preparation, and in your GMC exam you will also go through such criteria where your performance will be compared with the other candidates on that particular day. And we keep this standard very high and make sure that all the candidates get a fair feedback, not bad, not good, so that everyone is fair, and they get to know about their weakness so that they can prepare. And this is where the benefit of the second mock kicks in. So you do your first mock, get the result, listen to your feedback and listen to your performance, and start working on your weaknesses, and take a break for about 5 days to 1 week and do your another mock, where you will be able to reflect on your preparation and reflect on your previous weaknesses and improve. And if there is any more mistakes are left or any weaknesses are left, then you can start working on them and be ready for your final exam. So this is how we offer PLAB 2 full course, and our full course is really beautiful. In our course, I just want to now show you what you will get inside the course. Let's start with looking into the PLAB 2 foundation course. First of all, here you will see the label as a PLAB 2 full course, because in this you get the access to the foundation modules. Within your course, when you enroll, you will come, and when you click on, you can see on the top here the class links. You will not need to wait for anything. You will get the class links automatically. You just simply log into your account and click on full to classroom via Zoom. Okay, so you click on that, it will take you directly into the classroom, where you will see other peers, other fellows who are preparing for the exam, and you will see that your tutor is also there and you can interact with them. You do not need to wait for anything. And when you want to get the study material, you can simply see all our study material is also provided. Here you can see the professional history taking. So we cover 5 days. We provide the 5 days teaching on the history taking, because this is really extensive, and you get different scenarios of history taking in the general medicine, general surgery, ENT, eye, gynecological history, genitourinary. So we cover every single aspect. When you click on this, under the professional history taking, you see different headings: general approach, general medicine and allied. And these are actually the notes that you get. If you want to download, you can simply download the copies of the notes that we will be using. But if you don't want to use the downloaded copies and you want to simply access the content online, you simply click on it and it will take you to the notes. All the notes are organized and all the scenarios are provided with the details how to approach and how to perform those scenarios, what are the delicacies, what are the important points in those scenarios. And the scenarios are beautifully arranged that you can practice with your colleagues and you can continue working, and all the important information is given, so you can simulate with your colleagues as well, so that you can, when you want, when you're free, you want to practice with your colleagues, you can do that. And these are the course material that we normally use in our course teaching. And when you have done that, you you can continue practicing on all the scenarios. And now going back to your course, we continue 10 days on teaching and interacting and providing the feedback to our candidates. Now you imagine you spend 10 days just doing those activities: history taking, dealing with the difficult patient, dealing with the relatives, dealing with the ethical scenarios. We will take you from the basics. This is why we call this as a foundation module. In those foundation modules, once we finish those 10 days, you will be stepped up to the next part of your course, which is a smart course. And smart course is actually advanced course, where you have to have all those primary skills, the basic skills that we will teach you in initial 10 days. In the smart course, if you see, on Mondays, here you can see on Mondays we cover the sim and scenarios. On Monday we cover the sim and scenarios, and on Tuesday and Wednesday we cover clinical examinations, the mannequins, and on Thursday you can see we covered the prescriptions and teaching scenarios. Then we do have carousel mocks. These are very good, very beautiful mocks, which are performed under practice, under supervision, with the tutor present, so that they can give you feedback. It's a group practice where you can interact with different colleagues, and you can learn from your personal mistakes and the mistakes of the others. You can take the role of a patient as well as of a doctor, and you continue learning. So we continue those activities on the high yield scenarios, which are coming recurrently in your exams. And then there are the videos. You can see all the videos are recorded as well. All the simman and the mannequin videos are recorded. You can access them anytime without any restriction, just through your portal. So you come into this, and if you're sitting free, you want to just simply watch any video, you can, and they can make you ready even before you come here. Okay, all the scenarios, especially the simman and the mannequin scenarios, are given. They are recorded, as well as we do the teaching. We have loads of mannequins, multiple sets of mannequins present in the academy, and we are the most organized, where you can come any Monday to the campus and find us do the simman. Any Tuesday and Wednesday, find us do the mannequins and clinical examinations. Any Thursday, find us do the prescriptions and the teaching scenarios. And Friday and Saturday, beautifully organized for the carousel mocks, the group practice, where you get the feedback on the recurrent scenarios. This is our full course that will take you from the very beginning, from scratch, to the advanced skills, and make sure that you're fully prepared. And in addition to this, what else you will get? You will also get the videos of the previously recorded sessions. If you do not have the time, or if you don't want to wait for the course to start and you want to just simply jump quickly, you can start watching the videos, the PLAB 2 video course. All the videos are organized according to the skills. Now, if you come here, this is also the third course that you will get access to, so that you don't waste your time, you're more prepared. In this, you get the access to the foundation modules and the smart prep modules. Smart prep modules are the modules that the simman, mannequins, and clinical examinations of videos are present. In this course, you will get all the videos that are needed, and they are arranged in those sections. Now, in the foundation modules, if you click on that, you will find 2 different courses. They are arranged. We started adding them, and we will continue adding every month. So in this, you can find 10 different activities. These are 10 days recorded sessions that you will find. These are quite lengthy videos, and you can bypass, you can simply watch those videos and come for the smart course. And these are all the foundation course recorded, and you can see all the videos are available. You do not have any restriction. You can watch them as many times as you want, and you can pause them, you can come back without any problem. And if you're not fully satisfied, you want to watch more videos, you can go to the next month and you can start watching those videos as well, so that you don't waste your time. And once you're done with the foundation skills, you are ready with the history taking, you're confident with the structures and everything, then you can simply come to the next advanced skills, which are the Simman stations and Simman and the mannequin examination. So in this, you can see we have the Simman scenarios. All those videos are present there, so that you can prepare them before your exam comes, and even before you come to the UK. And when you come to the academy, you actually practice rather than you waste your time in listening the lectures and asking the questions and appearing like dumb. So you can bypass, you can jumpstart, and you can just simply watch those videos and be ready before you come to the UK. And now you can see the videos are arranged according to their sections, Simman scenarios, as well as the mannequins and clinical examination, and there is no restriction. You can watch them as many times as you want. This is a short demo or the overview of PLAB 2 Smart full course that we offer. In a nutshell, in the smart course and the full course, there are different sets of skills where we work with our candidates. Our group is small. We always try to keep the number of the candidates up to 10. The maximum number of the candidates in every single group is 15, so that we can offer them the maximum support and we can provide them the supervision that they need. And what you get in your full course, you get the foundation modules with the teacher present. You get the smart modules, smart course modules with advanced skills, Simman, mannequin, clinical examinations, prescriptions, and teaching scenarios. Then practice, supervised practice on the high yield scenarios and recurrent scenarios. Then you get 2 mocks, which are 16 stations, all with real mannequins and real Simmans, with the audio recorded feedbacks on your mocks, so that you can compare, and the result card produced as in the real exam, and you have unlimited access to the practice area as and when you want. And the next thing that I want to highlight, we never ask our candidate to pay anything extra, and they can attend the sessions as many times as they want, and they can attend until they pass. So that is the beauty. I believe that you will never get anywhere in the UK, not in the world, that we as a PLAB Guide team offer you. So that is a just overview, and if you have any question, please do ask us. Otherwise, simply join us and subscribe.